First, I'll be chatting about the beta receptor antagonist drugs, affectionately known as beta blockers. And what better setting to discuss the action of these soothing, blood pressure relieving drugs than the symphony hall? Recall from our sympathetic summer that the beta 1 receptor, with its potent heart activating effects, is symbolized by the rousing beta 1 bugle, while the beta 2 receptor is represented by the relaxed and dilated airway of the beta 2 tuba. Well, now I'd like to introduce the world-renowned beta brass section. Hold your applause, though. We're going to try something a little more subdued for this piece, a little more pianissimo. Hence, you'll see that the beta bugles and tubas are muted, so let these mutes obstructing the instruments remind you that we're talking about beta blockers. It looks like the conductor here has noticed that something isn't sounding quite right over there, and has silenced the beta brass players. Well, luckily the brass section won't be too important for tonight's rendition of the most relaxing and anti-hypertensive piece ever composed. That's Brahms' Lullaby. LOL, or LOL, should remind you, of course, that beta blockers end with the suffix LOL. In this sketch, we're going to cover different groups of beta blockers that have varying affinities for alpha and beta receptors. There are non-selective beta antagonists, such as propranolol, beta 1 selective antagonists, such as metoprolol and atenolol, and there are beta blockers with the capacity to block alpha as well, such as carvedilol and labetalol. And finally, there are some beta blockers that have partial agonist activity, such as pindolol and acebutolol. So many lols. For now, we'll focus on the broad effects of the beta blockers as a class, stopping periodically to feature each of these groups. So let's move our attention over to the percussion section, with a heart-shaped sheet music stand, and our star pianist, who seems to be struggling a little bit. Seems he's not quite strong enough to lift the piano lid that's slammed shut on his hand. Let his classically trained yet scrawny arm represent the decreased cardiac contractility caused by beta blockers, most of which have some antagonizing effects on beta 1. Remember that beta 1 adrenergic receptors are located throughout the myocardium within the atria and ventricles and affect cardiac inotropy. Now look closely at the notes, or nodes, on this sheet music, reminiscent of the SA and AV nodes on the heart, which also contain beta 1 adrenergic receptors that affect cardiac chronotropy and conduction. Blocking these receptors lead to negative chronotropic effects, and our recurring symbol for decreased heart rate is a low-hanging pocket watch, which can be seen dangling from this pianist's back pocket as he stoops to push on that piano lid. Additionally, blocking beta 1 receptors can significantly depress conduction through the atrioventricular node, potentially causing heart block. Use of a beta blocker can therefore lead to serious bradyarrhythmias in patients with second or third degree AV block, especially if the patient is also receiving another agent that slows AV nodal conduction, such as digoxin or a calcium channel blocker. So make sure the patient is unblocked before beta blocker use, and just read the sign, don't be a fire hazard, door to remain unblocked, which, as you'll notice, is on a shield-shaped sign. We'll use this shield whenever we want to convey heart block. Let's take a listen now to the xylophone. You know, that instrument that's all, hey, you could have practiced piano, but you learned me instead. Well, I like the xylophonist's enthusiasm, but it's a little much, don't you think? Notice the xylophone that he's playing looks like an anvil? That's because it's our recurring sketchy symbol for chest pain, specifically the pressure of angina, the angina anvil. The negative chronotropic and inotropic effects of beta blockers make them very effective in the management of angina. By slowing down the heart, diastolic perfusion time increases, and when contractility decreases, cardiac oxygen consumption drops. And man, is he into that solo. His nasal cannula flying clean off. Let this represent the decreased myocardial oxygen consumption that helps reduce the frequency of anginal episodes and improves exercise tolerance. As mentioned previously, all of the beta blockers have some antagonizing effects at these beta 1 receptors on the heart. But as we continue our discussion about heart effects, let's take a look center stage, where our beta-1 selective antagonists are taking the spotlight, as shown by this spotlight singling out our muted beta-1 bugler. We've labeled the spotlight A-beam to remind you of the beta-1 selective antagonists, atenolol, betaxolol, esmolol, acebutolol, and metoprolol. The label can also be read as A through M, since these drugs fall within the first half of the alphabet. This beta-1 selective antagonism makes these drugs cardioselective, so we've added another A-beam shining onto this heart-shaped stage. For patients with acute myocardial infarction, beta-blocker therapy has been shown to reduce infarct size and early mortality when started early, usually within the 24 hours, and lowers the risk of death when continued long-term. There are many potential beneficial effects of beta-blockers in this setting, including reducing oxygen demand and increasing diastolic filling time to improve coronary blood flow. So MI is represented here by these broken heartstrings on this heart-shaped harp. Almost like ruptured chordae tendineae, no? And since we've depicted the strings breaking acutely, remember that beta blockers are one of your first-line agents during the management of acute coronary syndromes, including unstable angina, NSTEMI, and ST elevation MI. Likewise, cardioselective beta blockers are often used as long-term therapy in chronic heart failure to reduce excessive tachycardia and the adverse effects of high catecholamine levels on the heart. Our recurring symbol for heart failure is a sad-looking, floppy heart balloon. Looks like our harpist had a few adoring fans, at least before the string malfunction. Besides some of the cardioselective beta blockers, another drug with proven benefits in the long-term treatment of heart failure is carvedilol. So notice next to our chronically failing heart balloon is an intricately carved wooden candle holder. Why a candle holder, you ask? Well, carvedilol is a non-selective beta receptor antagonist with some additional alpha-1 blocking effects. Notice that one of the snapping strings has extinguished the single alpha flame, our recurring theme for alpha-1 antagonism. So remember this carved candle holder for carvedilol, and you should have no problem remembering that it's not only a beta blocker, but additionally has some alpha-1 blocking properties. Let's add a fancy angel costume to our leading harpist, and this will emphasize the decreased mortality with beta blocker use, both in the settings of post-MI and in chronic heart failure. Think of these agents as guardian angels for improving survival. In these settings, structural changes in the left ventricle are a major cause of mortality due to progressive pump dysfunction. Beta blockers, however, may help reduce this cardiac remodeling by protecting the heart from excess circulating catecholamines. To remind you of cardiac remodeling and the beta blocker's ability to curb these structural changes, we'll make the area behind the heart stage undergoing some remodeling. I want to point out that beta blockers can actually worsen acute heart failure exacerbations because the circulating catecholamines may actually be supporting the pump function of the heart during these times. These drugs are started gradually at low doses, and the most benefit from reduced heart failure symptoms is seen only after many months of therapy. So, all beta-adrenergic receptor antagonists are effective in lowering blood pressure in mild to moderate hypertension. Beta blockers, however, are not commonly used for initial monotherapy, since they may have an adverse effect on some cardiovascular outcomes, particularly in older patients. Remember that center stage, though. Beta blockers can be especially useful for treating hypertension in patients with specific indications, such as those with concomitant heart failure or those who are recovering from an MI. See that pipe organ in the back? It's a steam pipe organ, obviously, as you can tell by the massive steam pipes powering it, and they look like they're about to burst. And you'll recall that these high-pressure pipes are a recurring symbol for the treatment of hypertension. Beta blockers have a few different mechanisms for lowering blood pressure. For example, they decrease cardiac output due to the negative ionotropic and chronotropic effects on the heart. Also, recall from the sympathetic summer sketch that beta-1 receptors stimulate renin production at the kidney, and beta blockers therefore also lower blood pressure by depressing the renin-angiotensin-aldosterone system. And what do you know? It's second chair bugle player, late as always, sneaking in and hoping the conductor doesn't notice. Remember that renin is represented by this yellow rain jacket and umbrella, and this closed umbrella being furtively tossed away will symbolize the decreased renin levels caused by beta blocker therapy. Notice also that we've made her instrument case inhibiting a beta-1 bugle, specifically, for that extra little reminder that it's beta-1 inhibition at the juxtaglomerular apparatus. Alright, now sit back and take a listen to the power and richness of the pipe organ as we discuss our next beta blocker. See the alpha and beta labeled stops that our organist uses to modulate flow to the pipes? The alphas and betas should help you remember labetalol. And just like carvedilol, labetalol also blocks both beta and alpha receptors, so it causes some extra vasodilation, resulting in decreased peripheral resistance. Notice the dilated floppy sleeves, as well as our recurring alpha-1 candle, extinguished by the air streaming from the pipes. Also, if you take a close look, you'll see that we've made the player pregnant. That's because labetalol is effective and generally safe in pregnancy, and it may help preserve uteroplacental blood flow to a greater extent than the traditional beta blockers. The safety of the other beta blockers is more controversial. Because of its combined alpha and beta blocking effects, as well as its rapid onset of action, labetalol is a useful intravenous medication for the treatment of hypertensive emergencies. Hypertensive emergency will be symbolized by this emergency shutoff switch next to the high-pressure pipes. But you'll learn that there are many other agents used in hypertensive emergencies, including nitrates, calcium channel blockers, and even other IV beta blockers, such as esmolol. Another fact about labetalol is that it's used in patients with acute aortic dissection. Therapy usually involves rapidly reducing the blood pressure to a goal of 100 to 120 systolic within about 20 minutes of diagnosis. And this differs from other hypertensive emergencies where blood pressure should be lowered more gradually. Let this large central organ pipe split down the center represent the severed aortic wall in aortic dissection. And keep in mind that other IV beta blockers can also be given as initial treatment, in addition to a vasodilator. Alright, I know what you're thinking. A symphony is no place for bagpipes. But I think you might find that soothing, obstructed, nasally sound works quite well, actually. Notice that the bag looks like a big, hypertrophic heart. Also look at the piper's face. She's straining against an obstruction, which together evokes an image of hypertrophic, obstructive cardiomyopathy. In this syndrome, the size of the ventricle, or interventricular septum, not only hinders diastolic filling, it also obstructs the left ventricle outflow tract, which can lead to acute hemodynamic collapse. It may seem paradoxical, but in these situations, beta blockers can be useful for slowing down the heart, thereby increasing diastolic filling time and getting that obstruction out of the way. Honestly, I could listen to that shrill, sweet cry of the bagpipes forever. But let's move our attention over to this musician here playing the bell. A kind of ominous, head-shaped bell. The mallet against the temple should make you think of those pounding unilateral headaches experienced by migraine sufferers. Beta blockers such as metoprolol, timolol, and propranolol can be used as prophylaxis in patients who experience episodic migraines. And I hope you notice his bow tie. That bell guy, always trying to get attention. Anyways, see how it's bright red with all these little lightning bolts? And as it is a bow tie, it's sitting right on top of his thyroid cartilage. That's because it represents thyroid storm, the catecholamine surge seen as a serious complication of thyroid toxicosis. It can present with agitation, delirium, fever, and tachyarrhythmia, even causing death. So treat it with the 3 Ps: propranolol, propylthiouracil, and prednisolone. That's a mouthful. And it's in this drawing mainly to remind you of propranolol. Remember that beta blockers are used merely to reduce the symptoms of the increased sympathetic activity associated with hyperthyroidism. This makes them useful for providing symptomatic relief of Graves' disease, for example. Hyperthyroidism is associated with an overall increased expression of beta-adrenergic receptors in various organs, and patients with Graves are often given beta blockers to reduce the symptoms of hypertension, tachycardia, and heat intolerance while awaiting definitive treatment, which is surgery. Another important thing to remember for this exam is that beta blockers will not reverse the exophthalmos and myxedema. Alright, look at the conductor. You can tell that all the musical mishaps on the stage tonight are starting to wear on him. He can even see the headlines now, the patron saint of mediocrity. Just look at how severe his tremor is. Let this tremorous baton remind you that beta blockers, such as propranolol, are first-line treatment for essential tremor, which classically worsens while maintaining a particular posture, like holding a baton. The very last therapeutic use for beta blockers that we're going to mention is their role as a type 2 antiarrhythmic. Beta blockers are effective in treating both supraventricular and ventricular arrhythmias, which may be another factor contributing to improved survival post-MI. As we can see, the late bugler's friend here is trying to cover for her by playing some pre-recorded brass hits. We'll always include a rhythm-inducing record when we want to convey the important antiarrhythmic effects. But stay tuned for more info on type 2 antiarrhythmics during our video featuring the beta brass duet. Alright, it's time to move on to beta blocker side effects. Remember that we've already covered the beta-1 side effects of bradycardia and heart block. Well, now I'll point out a few beta-2 blocking side effects to keep in mind. It looks like our muted beta-2 tuba player hasn't emptied his spit valve in quite some time, causing some serious huffing and puffing. Let this wheezing blue bloater remind you of exacerbated asthma and COPD symptoms caused by non-selective beta receptor antagonists. Remember, non-selective beta blockers, such as propranolol, block beta-1 as well as beta-2 receptors, which may constrict the airways and worsen pre-existing obstructive airway disease. Instead, a cardioselective beta blocker may be the best option in a patient with concomitant asthma or COPD. But beta-2 receptor antagonism can have some therapeutic value. For example, take a look at the other muted beta-2 tuba player. His mute is colored like an eyeball. And notice that he's also regretting not emptying that spit trap for the last few months, so he let it loose, right on stage. Local administration of beta-blocking agents can be used during the management of glaucoma. Specifically, they reduce the production of aqueous humor in the eye by blocking the beta-2 receptors at the ciliary epithelium. The non-selective beta blocker timolol is especially useful for topical use in the eye. Remember, the key here is that these agents minimize the production of aqueous humor, so imagine that he's going to try to minimize the amount of spit he spews into that valve on a daily basis. Thanks for keeping it clean, Tim. One last side effect to mention while we're still up on stage, surrounded by the musicality and moisture of the orchestra. Yep, it's the floppy tromboner. Yep, we went there. Keep in mind the side effect of impotence in men with beta blocker use. Next, let's head to the front of the stage, where there's some unwanted audience participation going on. The boy with the plastic bugle represents acebutolol. So plastic bugle, acebutolol. Remember that it's part of the A-beam cardioselective beta blockers, and that's why it's a plastic bugle. The boy with the pin represents pindolol. These drugs have partial beta agonist activity, so imagine the irritating and agonizing sound of a tiny bugle coming from the audience. They're young imitators, so they're not full agonists. These partial agonists aren't recommended in heart failure, since these patients should be on beta blockers that protect the myocardium from circulating catecholamines. This is represented by the holes our pindolol kid has poked into the heart balloon. Not a good mix. And for our finale, let's focus our attention once again on the conductor, who looks quite defeated by this level of incompetence displayed by the muted brass players. Don't give up so easy, Leonard. Maybe adding a little more glucagon to that tea will rejuvenate you. The most dangerous cardiac side effects that may occur with beta blocker use or overdose, which include bradycardia, heart failure, and heart block, can be overcome directly with glucagon. Glucagon stimulates the heart using glucagon receptors, which aren't being blocked by beta blockers. Encore, let's sum up the sketch. I'll play some of Brahms' Lullaby to keep with the theme and get you all pumped for studying. First, we talked about beta blockers' actions on the heart, reducing inotropy, as well as reducing chronotropy. See that weak arm and the SA and AV node notes on the heart-shaped music stand? We also talked about beta blockers' role in treating angina by reducing oxygen demand, as depicted by the angina anvil and the reduced oxygen demand of our old xylophone player. Then we talked about the A-beam. Remember that A-beam is focused on the beta-1 effects, meaning the A-beam beta blockers are beta-1 selective. Beta blockers are great for patients recovering post-MI or suffering from congestive heart failure, as depicted by the chordae tendineae ruptured harp and the floppy deflated heart balloon. Our angel reminds you that they've been shown to reduce mortality. Ooh, and remember that carvedilol carved candlestick? Which is also proven to be a benefit in heart failure. It has alpha-1 blocking effects. Our steam pipes remind you that beta blockers, although not usually first line, do have an important role in treating hypertension, not only from reducing cardiac output, but by also inhibiting the renin-angiotensin system, as depicted by this late bugler in the yellow rain jacket. Remember, the non-selective beta blockers shouldn't be used in asthma or COPD, as it may exacerbate their symptoms. Need I mention again the floppy tromboner and the beta blockers' side effects of impotence? Some of the beta-2 blocking effects can also be advantageous, like Tim here's timolol for reducing aqueous humor production. And finally, glucagon can be used in beta blocker overdose, as depicted by the glucagon sweetening packets used by our conductor. Oh, wow. This music really starts to get to you, doesn't it? Anyway, and probably the most important thing of the entire video to remember for the exam is